Yeah. My topic is children, women, and the elderly challenges during the pandemic. Okay. Since I am dealing with the children, before I go into this, I would like to share a story. There was a man who was very rich, and he was a Muslim man. One day he wanted to come to the for prayer. So when he came to the mosque, he came in his big BMW and he just parked the BMW and he walked to inside the mosque, just leaving his sandal outside. So when he went inside, he prayed, he thanked the Lord for everything he has got in his life, his position, his status, everything. And when he came out, he saw that his sandals were missing. So he was very upset. His concern was he had to walk in this barefooted to his BMW. So what he did was he was praying to God and he was telling God, how could you do this? You know, I am such a respected person in the society and I have to walk till my BMW now in my bare feet. When he was saying this, he suddenly saw a man coming out of the mosque. He was literally on his knees and he was using his hands to come out of the mosque. He had a radiant smile on his face. So he went to this man and he asked, what makes you smile? This is so hot, scorching heat, and you are smiling and you are using your hands to come out. I really don't know. How can you smile? The man replied, I am happy because I was able to come here to God's home. I am happy because I am healthy still today. I am happy because I have a nice family and I am going back to my family now. I am happy because I stay in plastic shanties and I don't stay on the pavement and I am not totally wet in the downpours or I am sweating in the scorching heat. And lastly, I am happy because I know you are the person who is going to now drop me at my home because God has sent you to me. The man was shocked because that was his lesson. He picked up this man, took him to his car and dropped him at his residence. So my topic is, we are all talking about the disaster, and my topic is the way you focus on your life, the positive attitude towards life. Okay, now I will give you an alarming feature. There are about 2.2 million children in the world who constitute approximately 28% of the world's population. We all know the most accepted modus operandi in this pandemic is isolation and social distancing strategies. There has been innumerable studies which has indicated that compared to adults, this pandemic may continue to have increased long-term adverse consequences on children and adolescents. A study proved that the quarantined children experience greater psychological distress than the non-quarantined children. 68.5% had worry, 66.11% had helplessness, and 61.98% had fear. In this pandemic, children experience disturbed sleep, nightmares, poor appetite, agitation, inattention, separation-related anxiety, irritability, clinging behavior. They express lower levels of effect, not being able to play outdoors, not meeting friends, and not engaging in the in-person school activities. Due to prolonged confinement at home, children's increased use of internet and social media predisposed them to use internet compulsively, access objectionable content, and also increased their vulnerability for getting bullied or abused. Now we talk about the special needs. They also encountered lots and lots of challenges during the pandemic. Confinement in one place increased their hyperactivity. Now, when we also talk about the underprivileged children, they were more vulnerable to depression, anxiety, suicide, exploitation, and high dropout rates. Isn't it alarming? All the research which shows all the negatives. Now, let's talk about the positives. Like the man who said, a different realization of the life. He didn't have anything, but he had everything because he had that positive outlook to life. So, let's do this pandemic planning. Have we ever thought this parents' physical presence, this undivided positive attention and reassurance is a blessing for our children? Let us focus on that. Increased awareness of the children about the pandemic only through age-appropriate authorized organizations like WHO, UNICEF, that will increase. How many of our children have this awareness about the surroundings? They are always into the book, but because of this pandemic, they have got this awareness. They are actually reading the reports of UNICEF and WHO. To alleviate the anxiety of the children, let us monitor. Let us give them the news, but let it be monitored and let it be encouraged. We are inculcating a very good habit in our children to go into the news. Parents can be the best role model for the children. We need to focus here that we need to be the role models because we are at home and we can be the best role models for our children. Have we ever thought children have become most responsible, most accountable, and most structured? Because they are getting up, they are opening the computer, they are sitting in front of them, they are doing the class. Please go back before the pandemic and think, you are running after them with your tiffin, you are running after them with your water bottle. Do you do it now? We have forgotten to see these positive things in our life. These are the positives which I want to focus. We are exploring their creative pursuits. We are sitting with them. Our creativity is being increased. Their creativity is being increased. They are drawing with us. They are singing with us. Have you ever seen the sky? Have you ever seen a sunrise? Have you ever seen a sun like going into the west? No, but now we are doing this. These are the positives and we need to focus on this because that is mental health. Teachers, a lot of survey on the children because my child is into a school and I interact with her and her friends and the parents. Teachers are into more creative online academic and non-academic sessions, making the classes more and more interactive. Children love to do that. They are being given projects, they are doing it in the computer, they are sending it. We always focus, they are in the computer, they are this, they are having, but if we just shift our focus and focus on this, we will see there are so positive things which we are just overlooking because of the pandemic. More focus on the pro-social behavior, emphasizing human virtues like empathy and patience. Do you know how empathetic they are now? Please speak to your children in the community. They are so empathetic. They have the patience. They all ask, when will the school open? When will he go to school? Yes, they are missing their school. That is their second home. But they have learned to be empathetic. They have learned to be patient. And we can help them to understand that social distancing is not equivalent to emotional distancing. What do we have to do as the mental health professionals? Coordinated and innovative mental health care delivery with children, parents, teachers, school counselors, community volunteers, NGOs, police, and everyone. We have to motivate them to do this innovative mental health care system for them. We are already into this teleconsultation facility for the needy. Recognition of the physical manifestations of the stress, emotional health problems in the children, and planned intervention for the same. Identification of the predisposing and precipitating factors associated with the child's current manifestations. Why is the child doing this? Where is the predisposing factor? Let us explore. It is not only the pandemic. There are other things also. I am coming home. I am sanitizing. What impression I am putting on my child? My mother is worried. My mother is tensed. Developing stronger networks and partnerships with the mental health professionals, that is another role where we have to play. Now, we all talk about this pandemic. I would just like to share one essay from a child who was asked to write about Corona. Teacher asked the students, and the child wrote, Corona is a big Chinese festival celebrated by both young and old all over the world. During this festival, schools, markets, churches, etc. are closed and exams are cancelled. Everybody wears masks during this festival. It is the time when every school-going children gets a smartphone as a gift from their parents. During this festival, daddies learn cooking, washing and cleaning, while mummies and children spend their time with mobile phones. I love Corona festival very much. See, this is a child's realization. A child who has been asked, don't we think the child is more talented than us? Yes, because the child is not thinking about the pandemic. The child is thinking what the child has got. And because we are so tensed, because we are so stressed, of course, we really need those. But my focus is, can we just shift and look at this part also? I can also give lots research on women and elderly, but I will not go into that. I will just focus on the challenges of the women and the elderly during the pandemic. Lots and lots of misinformation are there that are not unreliable, that are incomprehensible. And there are fake rumors. If you do this, you will not get this. If you eat this, you will not get this. If you do this, this will not happen. So those are the misinformation. There is well-being and mental health. There are depression. This has already been talked by all my three distinguished panelists. And they have talked about depression. They have talked about stress-related disorders. They have talked about panic, substance abuse, low immune system. Yes, these are the challenges. There is nutritional vulnerability. There is malnutrition. There is disruption of necessary food supply. There is shortage of adequate materials. There is, of course, economic vulnerability. There is loss of job. There is no job. There is financial constraints. There is violence and exploitation. Of course, there is discrimination. There is gender inequalities. We have lots and lots of research on battering and physical violence. But what should be our focus on? Our focus should be on the community. It shouldn't be the service delivery. It should be the community-based approach. Why? Let me explain. Service delivery is reactive, but community-based approach is proactive. Service delivery is needs-driven, but community-based approach is the core problem-driven. Service delivery has minimum participation. Community-based approach has the highest participation. In service delivery, we do the top-down approach, but in community-based approach, we have the bottom-up approach. Service delivery is a one approach. Community-based approach is constantly reinventing approaches. In West Bengal, we are all worried about the second wave about the corona. But last week, we were all worried about the cyclone Yash. So we are every week, we are constantly reinventing approaches because that is the community approach. Service delivery creates dependency, but the community-based approach, the power shifts to the community. There is a community ownership. Let us empower our community and they will take care. There have been lots of questions. What will happen? The third wave is coming. What will happen? The children will go. What will happen? What is the mental health of the teachers? Let us not focus on those. Enough, we have focused. Let us now focus on the positives because we need to give a better environment to our surroundings. Service delivery is static, but community-based approach is adaptive as the situation changes. Service delivery, there is low training needs, but in the community-based approach, we have the high training needs because we have to focus on the ownership of the community. Now, what should be our approach to our disaster preparedness? That is the community-based approach, involvement of the community volunteers. It should be culturally sensitive. Correct information dissemination should be there. We should enhance our social support system. That is the main thing. We can be in isolation, we can be quarantined, but we can always have this connection, this mental connection. Why isolate them? Why discriminate them? Why have this stigma? Let us actually take them. Let us have this mental connection with everyone, and we all will overcome it, because I believe we can overcome it. Strengthening the mental health care centers and the rehabilitation centers, because people should not feel that they are left alone. In your community, you have this rehabilitation center. In your community, you have this mental health professional. Call them up, and they are there to help you. Institutionalization of the psychosocial care services along with the available infrastructure in the community. We will give the psychosocial care, but we will use the community infrastructure, so that will be much more approachable. There should be continuous collaboration and coordination with the different stakeholders. Since I'm from the Institute of Psychiatry, we have actually done community-based approach with children during the pandemic. These are the people these are the professionals who are into the field, working with the children, helping them to learn how to sanitize your hands, how to use the COVID protocols. So this is the approach, community-based approach. This is with the women, the community-based approach with the women from the Institute of Psychiatry. This is with the different stakeholders during the pandemic. This is an awareness program, and this is, in a nutshell, my presentation.
As we are out of time, so we can't take many questions, but we can take a few. So there is a question from a student: how is COVID affecting the mental health and studies of the students studying in higher classes in a positive way? If any of the panelists want to answer it.
Okay, just let me, with the looking at the time constant, let me just quickly give an outcome that yes, the students have a lot of positive outcome. Like, what is first positive outcome is that students become very responsible. What Dr. Ilora has already said, that they become responsible because it is not driven by the teacher. They have to be proactive to learn. So what we have seen, that the good student become good. But the challenge is that the student who are not so good, who are below average, is facing real difficulties. They are not able to come out. So the good students are doing much better, but the below average, who needs teachers push little more, who are not able to take up, is having problem. Another, they are at home, comfortable situations. So the people who have the comfort at home, have a separate room, they are doing good. But on the other hand, the students for the first time got a separate bed in a hostel, doesn't have that. So those kinds of students who have those problems are really facing very difficult, because there is a joint family, cannot get a real space to study like in higher education. So getting problem. Third aspect, I would say there are a lot of lab-based course. A student has to do it, a lot of looking into it and then trying out. So the student who is able to afford, who is able to do it with some other connection, is able to do it. But there are many students who are unable to afford. So I see that digital divide has come up. The digital divide is making the people who are able to get it doing better. So you need to rethink that the people, the students who are unable to get the services, how to reach out to them. But as a whole, positive, I said these three aspects, we see that proactiveness, doing it, everything is increasing. One danger, I would say, is the digital dependency, which is also coming in different research. The student surfing the restricted site because they have got for the first time, particularly the adolescent student of 9th and 10th children, when parents are inadequate, unable to monitor what the child is doing, are getting into those kind of digital addictive risks. So we have risk, but still these positivities which are coming up are definitely need to be nurtured and sustained for future. They become much more digitally advanced. Any other panelist can respond. Thank you.
If anyone wants to add something in this. Any other?
Yeah, I just want to say that
Nothing much to add
a
to
lot of
that.
self-learning is happening with the students, and though we used to see that peer learning, like weaker student being getting information from a better student, has but then self-learning, they have to find out their own resources and learn. That is happening quite a lot. Yes, sir. Thank you.
Thank you, sir. So we are moving to the concluding session. So I would like to invite again Professor Santosh Kumar for his short concluding remarks, sir. Over to you, sir.
Thank you. It was a wonderful session listening to everyone. And a lot of solutions have been suggested, what have been practiced out before the COVID and after the COVID, which is when there was a slash and then the second wave came and the concern for the third wave as well. NIDM is also having a working group and where you can contribute on this how to prepare for the third wave, and especially in relation to the children's care. And in the third wave, what is the possibilities of kind of likely to affected children, and how these could be, what kind of a strategy which we can suggest that each of the state government and the community can take. One is the suggestion for the government, another could be for the community, and those community institutions can come into a kind of a forefront and take care of that, as all of you have spoken about that, and the various initiatives which have been very successful during that time. And some tools which I flagged in the beginning, that what are the essential tools which you think is important to understand the trauma care, and how the habit and behavior could be a kind of a positive story was shared, that how children they are looking at as a kind of a, when they are writing essays in their school. And many of times we are thinking pandemic, but many a times it is also thought as a kind of a festival. So understanding the minds, young minds, is much more important, their engagement of COVID-19. In our neighborhood also, we find that children are, the moment they get, even if the smallest of the kind of opportunity to come out and interact, their peer group, and they are playing and everything. So one that probably we need to understand in this kind of trauma care, that what is the likelihood of infection rate amongst the children in the third wave. And during the first wave and the second wave, we were of the view that children will not be much of a career kind of a thing, but some studies said that they are potential career. But disease will not be a kind of a very serious. And two of the cases which were brought from Maharashtra, large number of children got affected, and also other states also. There, the doctors are saying that although large number, 10% of the children got affected in COVID-19, but the severity index was much less, and so hospital care was not there. So that also protects parents also going into trauma, and also the children going into the trauma. So how we can draw these positive stories for building our own capacity mentally, that how mentally we can get alert, which you people have beautifully narrated through case studies, and that was brought in. Nobody went out and they don't have opportunities, and many a times they become orphans. Children are also becoming orphans. This particular COVID wave 2 has been the example of kind of children getting orphans. So taking these two lessons and also the case study which was also presented by Professor Rao, and then further elaborated by Mr. Ahmed, when the first presentation was made by Mr. Subasis, Professor Subasis. So when we combine all together the learning, which we say that it has to be given top priority, the mental health care, number one. And this cannot be negated, and it should be brought in the forefront for the preparing for the third wave and also for any other disasters which we are likely to face. One example came that from West Bengal, that during the COVID-19, there was also a kind of a disaster. So in West Bengal, in Orissa, and in Gujarat, in Mumbai. So this kind of examples are coming, which is a kind of a cascading impact of disasters. One, that communities are affected by pandemic. The other is community are also getting affected by the disaster which is occurring due to natural activities. And the third is that poverty and other challenges which are there. So what we say that it multiplies. So mental well-being depends on many factors, and in what factors the people are positioned into. So there the suggestions which have been offered by all the four distinguished panelists would be very, very useful for us in taking this input. I'm sure that you would be sharing your PowerPoint presentation. And even if you are having some problem in sharing that PowerPoint, you can share your content, which we can use in the kind of the other report. And this report, or the workshop of this report, will go to the working group report. And there we can bring in those issues what you have flagged. So, and the questions which have been asked by the participants in the beginning of this webinar, and which will be duly addressed by all the distinguished speakers. So I'm grateful to all of you, and the kind of presentations and the kind of good learning and a very kind of a thinking that you have given a very positive environment, that in how in this positivity the mental state and trauma could be taken care of, whether it's a wave 1 or wave 2 or wave 3 and subsequent waves, or maybe any other disaster signal. We need to prepare, and if we are prepared, the challenges are and the impact would be reduced to minimum. So I express my gratitude to all of you, and thank you very much for one, that being with us, coordinating with us, and making your views, sharing your views with the larger audience. And for this, we have definitely benefited. So my team, Mr. Ali Haider, our Executive Director, Major General Manoj Kumar Bindal, and all the technical team who is working behind. So I extend my heartfelt thanks to them. And also, we are grateful to the participants who are there and attended this program. Without them, it would not have been a very, very successful program. So I just close here. If Ali has to say something, then he can say. But on behalf of NIDM, once again, I extend my gratitude to all of you. Thank you very much to the Central University, Rajasthan. Thank you very much. And also our resource person from Kolkata, she brought the major point from. Thank you very much to all of you.
Thank you, sir. Thank you very much for your concluding. Thank you, everyone. It has been a wonderful session. As a formal vote of thanks, I would like to extend my sincere thanks to Major General Manoj Kumar Bindal, Executive Director of National Institute of Disaster Management. I would also like to extend my sincere gratitude to Professor Santosh Kumar for his guidance for the success of this webinar. And I would also like to thank to all the guest speakers, Dr. Shubhashish Bhadra, Dr. Prashant Roy, Ms. Ilora Barik, and Dr. Atiq Ahmed. We are very glad that you could take out your precious time and shared with us your experience and precious knowledge you have. At the end, I would like to thank all the participants for showing interest and being with us throughout. With this, we would like to conclude the session. Stay safe, stay healthy, all of you. Thank you all.
The story of BMW. Thank you.
You are connected and maintain your safety situations. I hope to some extent it might have given some answer. Yes, Ali, you can take up the next question.
Yes, sir. So it was a nice answer, sir. Sir, this next question, that how that there is a barrier because of the lockdown. How to interact with community in the times of COVID special lockdown? How we can interact?
Yes. See, lockdown is there definitely. We need to understand, take care of the lockdown and the COVID protocol. No way you are supposed to break the lockdown. but we also understand what is possible within lockdown. A village area, in an urban area. So now lockdown characters also have changed. So first of all, being available doesn't mean only physically present. Even giving a call and asking how are you, what is happening. So being connected digitally is the new platform which you need to use and activate. Like we have seen a lot of digital volunteership in mobilizing plasma, in mobilizing oxygen, in mobilizing ambulance support. These are happening. So be connected wherever possible. Create the group, connect them, connect through one member, talk to others. Show being connected. Wherever possible, do visit. If there is a big field, if there is a big place in the rural area, there is no dark place usually. So if there is a common place, so bring them together, maintain physical distance, and you can talk, you can have yoga together, maintaining the distance and being that togetherness helps a lot. Maintaining the COVID protocol. There is no question of breaking the COVID protocol wherever it is possible, because when you come to the nature, when you come to a green place, those kind of chemicals heals our body, and those natural situation called as a naturopathy, which helps us to reduce the stress. So we have to see what conditions they are, what condition we are, what is possible. Considering those limitations, the physical presence should be considered, or else digital platforms should be used. So I talked about digital volunteer. We need to create the digital volunteers more to get connected within us, and we can use the youth and others who have better digital knowledge and can work as better digital volunteers. Okay. Thank you.
Yes, sir. Thank you very much, sir.